Hello everyone, Dr. Chris Martinson here. It is September 24th, 2020, and COVID-19 seems to be rearing its head again, especially across Europe. A lot of lockdowns are being discussed right now, but are they really necessary? Let's find out. All right, let's begin here with the email of the day. This is coming to us from Mac, M-A-K. Let's check it out. It says, Hi, Chris. I've been watching all your videos since the start of the pandemic. I'm a huge fan of, and a lot of what you have said has helped me. And you're welcome for that, Mac. You made a video on the UK recently, and that was just on September 22nd, saying they are either corrupt or ignorant in not knowing the role of false positives. The interview with the health secretary, that would be Hancock, confirms that they are ignorant and do not understand false positives. This is confirmed in the interview this morning, and he gives a YouTube link. We're going to go to that YouTube link in just a second. See for yourself. This is the subject, though, I really want to talk about. Mac nailed it here. Also, I live in England, and the UK government is major panicking as around 40% of the UK is already in local lockdowns. 40% in local lockdowns. And this includes major cities like Birmingham, Leicester, Wolverhampton. Here, there is no household moving, etc. Most services are still closed as the UK faces the biggest recession of any major nation throughout history. Nationally, no more than 6 people are allowed together, with fines of £10,000 being given out. Yesterday, the Prime Minister Boris Johnson has also threatened of military presence when needed. Military presence. This is really serious. So we would think the data would be equally serious. We'll take a look at that. All the politicians in Parliament are in agreement for an early second full lockdown and claim it will be the right thing to act as soon as possible. Maybe cover this, as most of the economy and businesses are devastated already. Mac, I'm going to cover that right now. Thank you very much for that email. So let's move on and take a look. So remember on September 22nd, I said, based on these the way certain politicians and health ministers are acting, are they ignorant or are they corrupt? A little bit of a toss-up there. Right now, what we're going to do is we're going to tune in and we're going to take a look at this video, which was just came out today on September 24th. But look at this. This is kind of fun. Before we even get started, 8,000 plus views. 83 upvotes and 288 downvotes. That's a bad upvote downvote record. Now, I don't believe it's the Sky News that's being downvoted. I believe it's actually this would be the let me see if I can get this back. Yeah, so this would actually be because of the subject matter in here. So let's take a look at this real quick. Let's go on and take a quick peek here.
According to a report in this morning's Times, 30% of test results give false positives. So 30% of people could be self-isolating who don't need to.
Well, that's not quite right, because the app will only tell you to self-isolate if you've been in close contact with somebody who's tested positive.
Hold on, I guess I need to explain that he's trying to, this is the health minister, Hancock, he's trying to roll out an app, and it's going to be an app that would go on your phone, and the app is going to tell you if you need to self-isolate or not based on whether or not you've been in proximity to somebody who's tested positive, right? So the interviewer said, well, but hold on, up to 30% of the positives that are given could be false positives, so this is what he's responding to. So we said, no, that's not quite right. Let's keep listening.
Yeah, but they could be false positives.
Well, you will have had to be in close contact with somebody for it to tell you to self-isolate.
Hello, that could be somebody who's got a false positive, right?
So there is the question of how long you've been in that close contact is something where we're constantly improving the accuracy. But if you download the app and it comes up and tells you to self-isolate, that is because you will have been in close contact with somebody.
Yeah, but their test in itself might have been a false positive.
No, only if the tests that we have an incredibly high specificity.
So this article in the Times this morning is wrong?
Well, the question is, how close do you have to be for how long? And the app will not tell you that you have to self-isolate unless you have been in close contact with someone. We have...
Who in turn might have had a false positive. You know, they might have gone to have a test and they're told it's positive and it's not. And so people around them are being told to isolate for a fortnight and they don't need to.
But the proportion of people for whom the test gives a positive when they haven't had coronavirus is very, very small. That's under 1%.
Correct, that story.
Under 1%. Did you hear that? He says the proportion of people who test positive who don't have the virus is under 1%. That means he doesn't understand false positives. Remember, we just talked about this, that when you have a very low prevalence of the disease in your community, then the incidence of false positives becomes a very, very high proportion of the overall mix, no matter how great your test is. Because listen, no test is perfect, right? Your reagents can go bad. There could be a bad test procedure that happens. Somebody forgot to change their gloves. They got a little human DNA somehow into the samples. There's lots of ways these things can go wrong. Even, the perfectest test ever with the freshest reagents run in a laboratory against known samples will still be returning a false positive rate that may be under 1%. But when you're running it on 1 million people, of whom maybe 10,000 of them actually have the disease, and you have a 1% false positive rate, well, then you still have 10,000 people showing up as false positives against 10,000 legit signals. So you would have a 50% false positive rate. That's not under 1%. Let's rewind that just a tiny bit. Let's listen to him mangle this again one more time.
Proportion of people for whom the test gives a positive when they haven't had coronavirus is very, very small. That's under 1%.
Correct, that story. That 30% story
figure
is not correct. Okay. Where are we as far as tests?
Under 1%. That's what he says. So we can now come forward and we can make a delineation. We can declare a winner in this, and we're declaring ignorant to be the winner in this. The health minister of the UK doesn't understand false positives. It's shocking. But that won't stop them from shutting down the entire economy, despite that ignorance. It's really that tragic. I'm laughing because this is ridiculous. It's just ridiculous. Okay, moving on. Because I just needed to be absolutely certain. So I went to the NHS in the UK and to find out what does a positive test result really mean. And you can see here what it means. It means a positive result means you've had coronavirus when the test was done, but had the coronavirus. This isn't just a linguistic thing, UK to US. That's very careful wording because it doesn't tell you that you have an active infection. It says that you had it sometime before. So it could be an active infection, meaning the virus is still replicating and it's a live virus. It could have been well in the past, so the virus is no longer active in your body. It's all been neutralized, or maybe with antibodies in your body or some other way. It's not an active infection. That's all a positive result means. Or it could mean it's a false positive because they happen too. If your test is positive, you must self-isolate immediately, and now they've got an app that they're trying to encourage everybody to download. And as soon as you get that false positive test, you got to isolate, but it's more than that, because check this out. If you had a test because you had symptoms, you keep self-isolating for at least 10 days from when your symptoms started. So that's good advice. I'm down with that. If you had a test but have not had symptoms, you self-isolate for 10 days from when you had the test. So for somebody who had a false positive, they're saying you got to self-isolate and anyone you live with and anyone in your support bubble, I like the term of that, support bubble, must self-isolate for 14 days when you start self-isolating. So imagine this. You've downloaded the app. Your neighbor's downloaded the app. You've had contact with your neighbor because they're in your support bubble. And then they test positive, but it's a false positive. 30%, 50% of them are going to be false positives, depending on this, maybe more, maybe less, but it's somewhere in that district probably. And then all of a sudden, there's no second test. That's what I really wanted to point out. What we don't see in the NHS guidelines here is that if you do test positive, come on down, get a second test to be sure, because 30 to 50% of those are going to be false positives. Nope. We're going to ask you to self-isolate, and also anybody who's been in contact with you for a fortnight, right? A full 14 days pretty much. You're out of commission here. So that's what a positive COVID test result or SARS-CoV-2 test result means in the UK. All right. Moving on, though, we're looking at what looks like, oh no, just a huge second wave of infections in the UK. In Europe. So is this the dreaded second wave? Well, it kind of looks like it, right? It's a pretty scary looking chart right there. But as you dig into the actual data that sits down beneath this for individual countries, like let me just pick on one here, Belgium. We saw this in the data for the UK yesterday, same sort of a thing. Well, a second wave, what do we mean by second wave? So in this case, if we look at COVID-19 in Belgium, the epidemiological situation, how many people have been admitted to hospitals? Well, you can see here, this line just flattens out and just stays flat the whole way. The total in the hospital, same thing, really flat down this end down here. The newly discharged, well, you have to be in the hospital before you can get discharged, so that's a flat line. And the total in the ICU, again, nothing going on out here, right? So await, I would say here, what do we mean by a second wave? Let's talk about that because it's being used a lot now in the media. It's all over social media. It's in the newspapers. This was from the front page of the Wall Street Journal today on September 24th. They say Europe fights second wave of COVID-19 without full-blown lockdowns, but they are considering them at this point in time. And so this, I have a couple of exceptions to take with this. First, they're mixing up a lot of things here. So let's tear them apart one by one. Okay, as a quick reminder, we talked about this. A case really needs to be a person with symptoms that require medical treatment. That's a case, right? So there's the infection fatality rate, right? The IFR. And then there's the case fatality rate, the CFR. Not all infections become cases. This is standard stuff for diseases, right? This is standard disease terminology. But right now, the media, for whatever reason, is very busy muddying this up and calling anybody who tests positive, including false positives, is now deemed a case. So let's get that out of the way. Let's make sure we're clear about that. A case is somebody requiring medical treatment. Otherwise, they've had an infection with varying degrees of symptomology, ranging from none to moderate, or what you would experience as fairly severe if it was COVID and you were battling it, because we've all heard the stories of just how hard this strikes the people. It does strike pretty badly, right? As well, we've been through all of these terms just recently, so I'll let you read those. But I want to clarify one other thing. COVID-19, that's the disease. That's the disease condition. And that's actually in the COVID. That's what the D on the end stands for. It's a coronavirus disease, right? Whereas SARS-CoV-2 is the virus. So we're noting that these PCR tests are picking up a resurgence in what we're seeing here. What's actually being tested here? These are infections that are being detected. These are positive returns from a SARS-2 test. Some of them are false positives, some of them are real positives, but some fraction of these actually become cases, all right? And by the way, the early spring thing that we saw here, that would have been much more coincident between infections and cases because the people who were getting tested, the few of them who were already presenting at the hospital. So they would both be tested at that time and deemed a case simultaneously. So that's what that curve means. That's why we can't compare these two curves. These are entirely different curves. So let's not compare them, because on the other side, we're getting lots and lots of people being tested, but not that many of them are showing up as cases. So I got to tell you, it's tiring trying to keep track of all the. Every time we detangle something, it gets remuddied in the press, and I don't know why this happens, but it happens a lot. So as far as I can tell, this is kind of trying to keep all this straight is kind of like being this cat here. You know, this is just how it kind of feels to me right now. Maybe this is your own personal 2020 metaphor. You know, just when you think we're getting a handle around this whole thing, we got a grip on the situation, things just get worse and worse, and we're just not making any progress, and there's just stuff flying all over the place. All right, I love this video. This one made me laugh pretty good today, so I wanted to share that with you because we all need a laugh at some time like this. All right, getting back on the serious track, though. I should play that again, but I'm not gonna. Let's be clear, too. A second wave really ought to refer to death. So people hear, all the time we hear about, oh, there was a second wave and a third wave in 1918 for the Spanish flu that came around, so-called named Spanish flu, right? Well, here you can see it. You see the waves, right? First wave, second wave, third wave, but these are deaths per 1,000 in the population. So this is, and by the way, seeing that second wave topping out at nearly 25 people dying per 1,000 of population. Well, 1,000 times 1,000 is 1,000,000. So we would be looking at cases where it would be 25,000 people per million dying. To compare that to the 300 to 400 people per million who are dying from COVID at this point in time. Excuse me. So at any rate, but still, to go back a tiny bit, let's just rewind here. Look what the Wall Street Journal is doing. And by the way, there's no reason for this. There's no good excuse to have this level of confusion this late in the game. First, they're calling it a second wave, but it's not really a second wave. It's a second wave of positive test results. That's what we're getting. Second of all, there's COVID-19 is the disease. That's not what's being tested for either. Some of those cases, even I'm getting screwed up on this. Some of those test results will result in people who end up with COVID. But what's really happening is there is a resurgence in positive tests for SARS-2 in the community. Now, that's a very different story from saying we have a full-blown second wave underway or something like that, okay? All right, so carrying on, it sure looks like that second wave, that's what we would see in Spain. And I think Spain's getting a little worse than other places right now. I haven't had time to find out what all the treatment protocols are in Spain to find out what they're really doing, whether they're using things like that thing which shall not be named, because every time I get demonetized and shadow banned and all kinds of stuff. So that thing that shall not be named, which is a little tablet that seems to do good when given with zinc and an antibiotic, so I don't trigger that algorithm either. I don't know what their protocols are in Spain right now, but you look at this, you see these daily new cases. They really, again, look like on this chart that they very much are facing a huge full spike. But when we add to this the idea of, what are the daily new deaths in Spain? Yep, they're rising, but at a very, very much lower level than what we saw in the spring, right? Only a couple of reasons for that. Either treatments got really a lot better, or we're testing and detecting a lot more incidents of this disease right now because of the greater testing going on. But there aren't as many people dying from this because, in truth, many, many, many more people were actually exposed and became ill in the first round of it. Those are our options here. All right. So when we really look at this, let's be really clear, though. A second wave, if we're going to talk about second waves, it really ought to be on some comparable basis. Either we could call it in terms of deaths, we could call it in terms of infections, but we don't have good data for the first wave because we weren't testing. We weren't testing that many people. Now there's hundreds of thousands of tests being performed every day in countries that were performing a few thousands of tests back in the spring. So we don't even actually really have the data to be able to compare spring to now because we weren't testing so much back then. But it's fair to say, pretty good guess, that back then in spring, if we had full testing procedures in place, we would have seen much, 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 much larger spikes of detected infections back then. All right. So now I want to turn to this idea, though, that I've always been presenting. There's a three-way balancing act. Number one, step one, you want to stop the pandemic. Of course, you want to do that. You want to get the R0, the transmissivity of this particular virus, below 1.0 in your NPIs or non-pharmaceutical interventions, tight containment, isolation actions, masks, all of that stuff, right? That can really help. And you really do want to stop the pandemic, but why? Well, because number two, you really want to keep your hospitals working and you don't want to swamp your hospitals. So there's a balancing act between those two things. If you can't completely isolate and prevent the infection from spreading at all, if you can't completely eliminate it from your population, it's going to be there. It's endemic now. I think New Zealand, island nation, I think they had a shot at, and I think they did a pretty good job at eliminating the disease. That's fine, but of course now it's a very difficult thing to keep that off your shores forever after that. Because elimination is really not a viable strategy, especially not for an open economy where there's a lot of travel back and forth. What do? Well, now you just want to balance 1 and 2 very much, right? All you have to do is keep your efforts to slow down the spread of this thing low enough so that you keep your efforts high enough to keep the spread low enough so that you don't overwhelm number 2, right? Which is your hospital system. But against all of that, you got to keep your economy going because, as many people as you might save by preventing the disease from spreading at all, you might lose people to things like suicide and general malaise and economic hardship and things like that, particularly in a country like the United States, where if you don't work, sometimes you lose your health insurance. If you don't have health insurance, you can't afford health care. And we live in a society where that's many times a death sentence for people. So at any rate, all these three things just need to be balanced. That makes sense, right? Hopefully that makes as much sense to you as it does to me. Well, I want to talk about some weird stuff here because the UK is very much actively talking about just shutting everything down based on false positives that they don't seem to understand. But Australia too, this is a little blast of the past. This is a headline back from March. Let's look at this. What flattening the curve really means and why going hard against coronavirus won't work in Australia. Well, this is just from March. Here's what it used to mean, what flatten the curve actually means. Professor Blakely says the strategy favored by the federal government is not designed to stop transmission. Okay, that would have been the New Zealand approach. Rather, it aims to slow it to a manageable level so hospitals don't get overwhelmed. So this is what Australia was aiming for in March, and I totally support that. They were balancing 1 and 2 against each other. I get it. That makes good sense, right? So let me see what I'm going to do. So what are they? Yeah, let me cut to this. So right now, what's going on in Australia is troubling. And here's why. Maybe you've seen this. There's cases like this. So we'll just play this here and see where this goes. But there's a couple of women sitting on a park bench. They're just sitting there in Melbourne. And all of a sudden, 5 cops come up. And let's just watch this real quick. Maybe you can hear what she's saying. See that? Just came up very aggressively and grabbed the cell phone out of that woman's hand because she was, I don't know, she was daring to record. Watch carefully the officer who walks behind this woman. Just watch the action here. All right. Apparently, the crime being committed here is that they're not practicing what's considered to be appropriate, safe social distancing, not wearing masks, stuff like that. So Australia's taking it pretty seriously. And let's watch here too. I'm not going to watch this one. I'll read you through this one. So the Victorian police tell heavily pregnant women she's not allowed to rest during her 1-hour exercise. A woman 38 weeks pregnant has captured the moment Victorian police officers told her she was not permitted to rest on a park bench during her designated 1-hour period of exercise. Like in prison, I guess, right? You have a permitted 1-hour period of exercise here. The video, which is currently circulating on social media, starts just after 2 officers approached the heavily pregnant woman and told her that catching her breath on a park bench was not permitted. I just want to make sure I understand the rules, the woman says as she starts filming. You're allowed to be in a park, but you can't sit in the park at all? The answer was you can only be out of your house for one of 4 reasons. Sitting in a park is not one of the 4 reasons, the officer said. So fairly draconian measures, right? And we understand why, because apparently Australia's got a real problem on their hands where they're having a lot of trouble keeping the hospitals working. That's the only explanation I can understand for that. So let's go take a quick peek at Australian hospitals, see how they're doing. Oh, here we go. This comes from HealthGov down in Australia. And it shows here that current COVID-19 cases in hospitals and ICUs, let's see, that's, okay. Well, there's 10 and 2 in the ICU there. 8, that's 20 people in the ICU. 20? Huh. Well, how many ICU beds do they have? Well, let's see. Australia apparently has 9.4 ICU beds per 100,000 inhabitants. So we can find out how desperate the situation is. This is easy math. Australia's population is 25 million. 25 million divided by 100,000 times 9.4 means they have 2,350 ICU beds. So let's compare that back to what we just looked at. 20 divided by 2,350 means that a shocking 0.8% of Australia's ICU beds are now occupied by COVID cases. I guess that explains what we see here. Maybe that explains what we see here. I don't get this. I don't get this at all. I don't understand how it is that a health minister in the UK doesn't understand the issue of false positives. So sit that poor boy down. It's a 5-minute explanation. It's not that hard to grasp. I don't understand why Australia is going so overboard here to giving people a designated 1-hour exercise window, and you can't sit on the park bench. Not one of the 4 reasons. All of that when the balancing act seems somebody's lost the plot line. The plot line ought to be 1, 2, 3. You need these 3 things balanced against each other, right? So I can understand going hard if you need to stop the pandemic because number 2, your hospitals are in danger, critical danger of being overloaded. But you also have to balance that against number 3, which is you have to keep the economy going. This is not that hard to grasp. But right now, the efforts that I'm seeing in the UK and Australia are very much overgeared towards this side right here, number 2. Apparently, they are doing anything they need to do in order to just stop the pandemic because I guess they fear what might happen in hospitals, but there's no data to support that idea at this particular point in time. All right, you know what? I'm going to skip that because I got a whole thing on Fauci coming forward. So one of the things that I've talked about a bunch is that my personal ethos, my way of being says that if the data changes, I'll change my mind. Hey, I came across something today that did change my mind, and it's about N-Acetyl-Cysteine, NAC. Check this out. It's cool. Double-blind, randomized, placebo-controlled trial. I like it with N-Acetyl-Cysteine for treatment of severe acute respiratory syndrome caused by COVID-19. What they had here is they hypothesized that N-Acetyl-Cysteine administration could restore the redox homeostasis and suppress unfavorable evolution in COVID-19 patients. So we had a theory. The reason I was talking about N-Acetyl-Cysteine a number of months ago is because of the cytokine storm. I still think the cytokine storm is a part of this, but now we have the bradykinin hypothesis that seems to show that it's more a dysregulation of the bradykinin pathway that then results in some other things, including in some patients a cytokine storm cascade. But part of the cytokine storm, you're going to get lots of oxidants developed by the body. So having an antioxidant like N-Acetyl-Cysteine, you might think, well, the hypothesis is if we could deliver that to people, then it would mop up those be an antioxidant that would be mopping up those oxidative radicals and things like that from the cytokine storm, and therefore protect the patient. So that was their hypothesis. And so what did they do? They gave big, giant doses, N-Acetyl-Cysteine, 21 grams, 300 milligrams per kilogram, whopping for 24 hours, or dextrose, that's the control. The primary endpoint was the need for mechanical ventilation. Did people go on mechanical vent or not? And secondary endpoints were time of mechanical ventilation. So if you did go on, how long were you there? Admission to the ICU, time in the ICU, and mortality. So a bunch of good secondary endpoints. Didn't do longer term follow-ups to say things like, how were people faring a month later or anything like that. But in terms of a critical primary and secondary endpoints, looks like a good list right here. The conclusion out of all this, what happened was, 16 patients, which was 23.9% in the placebo group, were submitted for intubation and mechanical ventilation compared to 14 patients, or 20.6%, in the NAC group. The p-value 0.675, not statistically significant. No difference was observed in secondary endpoints either. So conclusion, administration of NAC in high doses did not affect the evolution of severe COVID-19. So that's a small study, but I think it was well done. Looks good and to the point. Now what do we do? What do we do with that information? If you're me, you say, well, I've had N-Acetyl-Cysteine on my supplement list now. I don't have any data to suggest it's good anymore, so I'm going to take it off of that list now. That's how we roll. If something changes, we change our mind. So at any rate, very much keeping all the rest of the things on that list. As well, we talked about there was some early data a while back that said that your blood group could be a factor where you A, B, A, O, all of that other stuff. So it turns out there was a fairly large study here that was done, and thousands and thousands and thousands of patients, and they separated out their COVID experience by blood group and didn't really see any difference here in terms of what really happened. So there wasn't really a huge difference in the overall distribution of whether you had COVID or not based on your blood type. So I think we can say blood group not really a factor, and glad to clear up that little dangly bit too. Now, ultimately though, when we get to these lockdowns and these crazy lockdowns that seem to be happening, we have to go back to this chart, this stunning chart that I put out on September 22nd update. Mortality risk from COVID-19, it grows exponentially with age. The statistical fit, almost perfect. Look at that R squared, 0.9967. Perfect would be 1.00. This is nearly a perfect fit. It says, if you want to understand the risk from COVID and its risk on mortality, all you really need to understand is the age. That's the great descriptor. And so basically, it would say that somebody down there at the 10 to 19 age group, which has a 0.1 deaths per 100,000, they would have a 3.5 orders of magnitude lower risk. 3 orders of magnitude, just big numbers, than somebody who was in the 80 plus group. So this suggests to us a rational set of policies, not based on having a tattletale app that then, says you got a positive test in our ultra flawed PCR testing regime. Now you got to go into lockdown, or locking down whole cities because we don't quite understand what's going on here. Instead, we could have a rational policy that would be based on keeping people safe based on their age and comorbidities and things like that. So again, my common sense approach for all this seems like common sense, or maybe it's uncommon sense at this point. Step 1, everybody prepares a terrain by taking vitamin D. You're eating well, you're sleeping enough, and you're avoiding stress. I don't know. I would find being surrounded by 5 officers on a park bench kind of stressful. Avoid that if you can. But this is something that every single health minister ought to be focusing on and telling their people: eat well, sleep well, make sure you have plenty of vitamin D in your system, and avoid stress as much as possible. That would be step 1. And that would do, excuse me, a huge amount of good. 2, everybody wears a mask in public. That seems like common sense, of course. But the at-risk people have to take extra precautions. Who's at risk? I got a chart right here. It's very suggestive of who's at risk in this story, but we already knew that, right? And of course, people with significant comorbidities. And by the way, if exposure or illness is suspected and caught early, you give this thing that shall not be named, plus this other thing, which I presume can't be named either anymore, without running afoul of certain things, within 2 days of symptom onset, whenever possible. And then if symptoms persist, there are other things we can do. But here's the thing. Maybe later a vaccine comes along, but we don't have to just wait and hope. We don't have to stay locked in our basement in fear waiting for this vaccine to come along. And we really don't have to shut everything down. That's totally not even remotely necessary. And by the way, this shutdown is now not just affecting people's jobs, but also huge chunks of people's livelihoods as well, by which I mean the businesses that many people own and operate are shutting down. Look at this. Check this out. Yelp data shows that 60% of business closures due to coronavirus pandemic are now permanent. And these would be all the small and medium-sized enterprises and businesses. Permanently closed. Done. Just toast. This is from September 16th. 163,735 businesses have indicated on Yelp they have closed. That's a 23% increase since mid-July. These are businesses that were hanging on barely for dear life, and now they're closed. So permanent closures, 97,966. That's 60% of closed businesses. They're not going to be reopening. This is going to have an enormous, has already having had a gigantic economic impact on the nation. And this is happening all over the world. This is US data, but this is happening in Europe, in other places like that. So you would think, listen, we get it. If you're saying here that, what's really important is, we desperately need to, stop the pandemic. I get it. Yeah, I got it. Thanks. But if your hospitals aren't even close to being overwhelmed, why are you crushing your economies? I don't get it. It doesn't make logical sense. It doesn't make rational sense. And by the way, in my country, the United States, billions and now trillions of dollars have been handed out in economic recovery sort of and stimulus sort of packages. Almost all of that went to really big, giant corporations. Almost all of that went to really big, giant banks. Almost all of that was used to bail out leveraged speculators in markets. Almost none of that went to actual individuals at the bottom of things, at the smaller businesses, to actual communities and stuff like that. So it's a pretty dire situation at this point in time, just by the numbers. All right. And before we get to that, check this out. This is unemployment claims. And what we're seeing here in the United States is that there are still 870,000 people filed for unemployment claims in this most recent period. 870,000. This would have been such a gigantic off-the-wall number just 10 months ago. And now people go, oh, well, it looks like we're improving. Not really. In order to be able to file for unemployment, you have to be eligible to file for unemployment. A lot of people aren't. There's rules. Not anybody can say, oh, I'm unemployed. Give me, I can file a claim. In most states, you have to have worked for a specified period of time. You can't have taken other benefits within a specified time window. So if you were already on unemployment for a while and then your benefits ran out, you're done. You're no longer eligible to file for new unemployment benefits. And certain classifications of jobs, you're just not eligible anyway. So the point I'm making here is that over time, you would expect to see fewer and fewer and fewer people filing for unemployment benefits because eventually nobody qualifies and that number goes to zero. And that's not a good thing because we've all been out of work for so long that nobody could actually file. So that's the data we're seeing. And there are still 26 million Americans who are out of work at this particular point in time. And so that's no recovery really to be seen in this data. Lockdowns make that worse. And those small businesses that are closing by the tens of thousands now, they can't come back. But what about all the other ones out there who are just hanging on by their fingernails? All it takes is another couple weeks or a couple months of lockdowns and we're all done. I don't have a good explanation for you for why we're seeing these lockdowns right now based on the data that I have access to. Because to me, again, it's always about balancing these three things. We want to stop the pandemic. Yes, I get it. We want to keep hospitals working. Yeah, I get it. We need to keep the economy going. I'm not sure that leaders in certain countries get that. I don't know what's going on here. But the data right now does not say that we're in danger of being swamped on balancing point number 2. I don't see the data yet to say that hospitals are completely swamped. And maybe that's a fear and they want to stop it before we get to the swamped. I get it. But if we had people taking vitamin D and if we had giving prophylactic early administration of those things that shall not be named, plus zinc, plus an antibiotic, I think I can say that without tripping the algorithms here. If we were doing those things, we wouldn't be swamping our hospitals anyway. That's what the data says at this point in time. All right. So the conclusions for today. Well, first, I see these UK politicians are panicking, and it is because of a failure to understand false positives. Either that or the ignorance is an act. But that little clip that we saw with Hancock, he fundamentally doesn't understand the false positive thing. He's sticking to his point, which is, but less than 1% are false positives. That's not how that works, and not how it works at all. So at any rate, either feigned ignorance or actual ignorance, doesn't matter. Doesn't matter which one, right? There's too much confusion showing up now about the differences between things like cases and positives and what's a second wave and what are we calling that and all kinds of stuff. So normally when I see these sorts of confusion start to pop up, it's because somebody's trying to be deliberately confusing. It's not because suddenly we lost the ability to understand what a case means. We should have known that back in January. We did. And once we learn that, we don't have to give up that knowledge. So I'm not sure why the media is all of a sudden confused about cases and confusing the difference between COVID-19, the disease, and detecting that somebody had the presence of some of the genomic structure of SARS-2, the virus, in their system. COVID and SARS, cases, positives, it's all getting murky, and I don't have a good reason for why that should be the case. I like to keep these things precise and separate That way we all know what we're talking about when we're having a conversation. It's a good thing. Too little emphasis on the importance of vitamin D and the early use of that other thing that shall be not be named and that other thing that shall not be named, along with zinc and an antibiotic. Too little emphasis on that. We've got fantastic data on this now about how these things actually work, and that ought to be front and center. That's still not front and center. I'm not just suspicious anymore, but I'm very antagonistic towards any so-called health authority who's really just a manager who's not leading with this particular bit of information, and instead has decided that the right way to go is to only let people out of their house for an hour for some exercise and keep them off the benches. It just doesn't make any sense to me. By the way, the second wave that does worry me the most is the second wave of economic damage that's going to happen, that is happening already. That wave is building, but we could add to that wave and make it worse by extending lockdowns and all of that. That economic damage is going to create its own gigantic set of issues. It's why I'm constantly saying people should do things like plant gardens, develop multiple income streams, trim your expenses. It's a little bit of a hunker down strategy, but it's also a diversification strategy that says become resilient, work towards regeneration. These are the things that are going to serve you best. Develop as many new skill sets as you possibly can. So if you know anything about how to be a carpenter or how to plant things or how to help heal people, any of these skills that you can develop, maybe how to brew beer, whatever those skills are, those are going to be really, really important as we go into this future. The disappointing part is that it didn't have to be this way. It really didn't. And so that's the part I'm having trouble with here is the degree to which there is just a complete lack of common sense on display here, the degree to which fear is being used to shepherd us towards certain outcomes that don't make sense at this point in time. But based on the science, I'm not at all worried about these second waves compared to what happened during the first wave back then for a couple reasons. First, that first wave went across and it seemed to strike a lot of the vulnerable population. And that was where most of the primary damage was going to happen. And second, we know a lot more about how to treat this thing now. And we have the tools, if we choose to use them, to figure out how to avoid getting really clobbered by this the second time around. That's how I see it at this point in time. So, yeah, back to that email of the day. It says, he lives in the UK and panicking, and 40% of the UK already in local lockdowns in that big places like Birmingham and whatnot, looking like they're staring down the barrel of another giant full-blown lockdown. Already the economic damage is really powerful and strong. So I don't know what to tell you beyond that besides tend to beauty and tilt towards regeneration. Always. I think the future is going to be really difficult. I think this second economic wave that's coming is going to be pretty hard. It's already hit a lot of people. So I think the definition of a recession is when your neighbor loses their job, and a depression is when you lose your job. I think a lot of people are saying it's not that bad. They're the ones who still have jobs. For the people who've lost their jobs, for the people who are already marginalized and at the edge of this thing, you have all my sympathy, and it didn't have to be this way. We could have managed this in such a more elegant way. This is totally doable without these gigantic lockdowns that we're facing right now. And I don't have a good explanation for why those are, but it's not supported by the data at this point in time. Thank you very much for listening. And by the way, we have a seminar coming up that's in just a few weeks from now. It's in October. Adam, take it away.
Hi folks, Adam Taggart here, Chris's fellow co-founder of peakprosperity.com. I'm here to tell you that this year, due to COVID, we're bringing our annual seminar digital for the first time ever. And the theme is going to be, how do we prosper in a post-coronavirus era? We're going to be tackling questions like, how can we protect our loved ones and our wealth? And is there a way to prosper through the coming disruption that COVID's unleashing? Because of this crazy time, Chris and I wanted to do something truly special for our followers, which is why we're bringing together more expert speakers for this seminar than we ever have before. And we're making it all available to you at a truly rock bottom price. We're going to have an amazing lineup of talent this year. We're going to have economic experts like Mike Maloney, former Fed advisor Danielle DiMartino Booth, technical analyst Sven Henrich, macro experts like Wolf Richter, John Rubino, Charles Hugh Smith. We're going to have energy experts like Richard Heinberg and Art Berman. We're going to have farming and environmental experts like Joel Salatin, America's Farmer, the folks at Singing Frog Farms, and many other experts in building resilience across your money, your health, your home, and your community. Now, the conference is going to take place the weekend of October 24th and 25th. It's going to be 2 days of packed presentations, panels, and live Q&A. But don't worry if you can't attend live or watch the entire live event. Everybody who registers is going to receive replay videos of all of the presentations, plus hours of additional bonus presentations that we just simply can't squeeze into a 2-day event, and trust me, we've tried. If you register now before September 30th, you're going to get all of this for the extremely low early bird price of $179. And if you happen to be a premium Peak Prosperity subscriber, you're going to get an additional 15% discount savings on top of that. To learn more, go visit peakprosperity.com/seminar2020. Chris and I hope to see you there in October.